Hello and welcome to Local Doctors on Call. I'm Alex Redmond. Before we start, please be advised that this show may contain sensitive material as we are showing before and after pictures of breast augmentation surgery. But for those that are interested in getting this, millions of women choose to undergo breast augmentation every year to improve their appearance, their self-esteem, and maybe improve their lives. Breast augmentation is one of the most popular and common types of plastic surgery in the United States today. So how do you choose the right shape and the right size for you and your lifestyle, or the right product? Dr. Scott Engel of Sarasota Plastic Surgery Center is here to answer all your questions about breast augmentation. Dr. Engel is board certified by the American Board of Plastic Surgery. He is a fellow of the American College of Surgeons and completed a fellowship in aesthetic surgery at the Cleveland Clinic in Cleveland, Ohio. Welcome to the show, Dr. Engel.
Thank you very much for having me.
Yeah, we're really happy to have you. This show is actually by popular request because we've had so many people who have been interested. When are you going to get someone that does plastic surgery and specifically breast augmentation, because it is one of the, if not the most popular surgery elective in the United States.
It is. It is. For the first time in 2011, the statistics from the American Society of Plastic Surgeons show that it is the most popular procedure performed in the United States last year.
Who's getting it? Who's getting this surgery done?
Well, many people of all ages, actually, as long as you're healthy. Women 18 years old up to 60 and 70 years old are having breast augmentation or breast rejuvenation surgery, not just implants, but rejuvenating their breasts to make them look more youthful and more aesthetically pleasing.
All right, this is a great opportunity, a great time to pick up the phone and call 361-4675. That's 361-4675, and ask Dr. Engel a question. If you've been considering getting breast augmentation or breast surgery, maybe you have a friend, maybe you have a daughter that's interested in exploring the possibilities. So go ahead and call us. All right, let's talk a little bit about the different types that you can get. Can you get, obviously you can get round, or there are others that are slightly different shaped?
There are different shapes, but the most common used in the U.S. are round implants. And so round implants, and then the type of material that's in the implant. There's a saline and silicone implants that are both available and FDA approved today.
All right, so between silicone and saline, because in the past there's been a lot of controversy about which one should I get. Have they upped the safety standards with silicone now?
They have. In 2006, the FDA approved silicone implants with the understanding that there'll be post-approval studies making sure it's a safe and effective device. And so we continue to have patients that are studied to make sure that it is safe. And all the studies so far have shown that there is no consequences or association between silicone and breast cancer or polymyalgia rheumatica or lupus. There's never been any association between them, and so that's why the FDA released the moratorium and say they're safe devices. So now a patient has a choice, knowing that a silicone implant is a safe device.
All right, our phone number is 361-4675. 361-4675. We'd love to hear from you with your questions about breast augmentation surgery. So why would you choose one over the other? What are the advantages or the disadvantages of getting silicone or saline?
Sure. It's a choice. So a woman has to feel comfortable with what's in her body. Now, we can give recommendations, and in my opinion, most often a silicone implant is a much more natural appearing implant. It just feels more like a breast, feels more like a native breast, and doesn't feel unnatural. There's also less rippling, especially for either breast reconstruction or breast cancer patients or patients with very, very thin tissue. A silicone implant just gives a more natural appearance. The advantages and disadvantages are saline. If you'd like me to show you, this is a saline implant. So if a saline implant ruptures, the good news is that you'll know right away you have a rupture, and that the saline solution that's in there is normal to our body and will just get absorbed. The downside to it is that then you walk around with an asymmetry, one breast size different than the other. And so those are the advantages and disadvantages. When you look at a silicone implant, you can feel yourself. It feels more natural. It's a much more natural feel to the touch, and the problem with silicone, if a silicone implant ruptures, you don't know right away. You may not know right away, and so you may have changes like pain or some hardness. We recommend that you do some studies like an MRI to see if there is a rupture. But our studies have shown there is no bad effects of silicone. Your body will just wall off the silicone and will not cause any harmful effects.
All right, now these are quite heavy. They feel, I mean, I would imagine that if I were a 34C cup or something, is that about right? What would this be for?
It's funny. A lot of women ask that. Well, what is this? And cup numbers for the cc's of implants and the cups are really just gauges to see what fits your body. Every implant, just because a friend has a certain size implant, doesn't mean it's going to look good on you, because you may have certain different native breast tissue. You may have a smaller chest before we put in the implant. So, in someone who doesn't have a lot of breast tissue and putting in, this is a 400cc implant. In someone who doesn't have a lot of breast tissue, this would be maybe a C size. However, if someone already has a good size breast, and then you put this in, well, then you're bringing them to either a full C or a full D. So it's really got to be something that you've got to try on. And I have patients try on sizes to see what they like under a shirt, and so it's not one size fits all.
Now, if you're small busted, would you be better off going a size up if you're thinking about getting something done, or if you just want to enhance your breasts, you just want to make them perkier, stand up more?
Sure.
Would you get the same size that you are, or would you go up a size?
Well, no, it depends, and we don't just decide what size you are and then put that same in. What we'll do is just literally try on this size implant and say, okay, well, this is a 300cc implant, and does this feel comfortable, and do you like it? And so it all just depends on what your activity level is and what you feel comfortable in a shirt, and that's really the best way to determine the size, is really trying it on and seeing what looks good.
All right, if you have questions that you'd like to ask Dr. Scott Engel, go ahead and pick up the phone, call 361-4675. That's 361-4675, because we are discussing breast augmentation tonight. And we can go ahead, if you like, and show one of the pictures that you have, because you have you have patient number one, and she has a before and an after picture. So we're going to go ahead and bring that up on the screen, and we're going to tell you what Dr. Engel is going to go ahead and tell you what was done here.
Sure. So this is a young woman who was 26 years old, and she wanted larger breasts. And as you can see on the left, this is her before picture. She doesn't have very much breast tissue at all, and so any implant at all is going to make it look a little bit augmented. So you need to be careful, and I recommended that she stay conservative, and so we used a 325cc implant. She tried them on, and it fit to her body. And so some women want a augmented appearance, some women don't want that augmented appearance, and the larger you go, the more augmented that's going to look, especially with such little tissue. So you can see just with her, she was thrilled. It was a small incision that was placed underneath her breast. This implant was placed under the muscle, which I generally like to place under the muscle most commonly, and she loved her results.
All right, and we have our first phone call. We have Laura on the line. Hi, Laura. Welcome to Local Doctors on Call. What would you like to ask Dr. Scott Engel?
Hello.
Hello, you're on the air.
Good afternoon. My name is Laura Sherman. I would like to ask the doctor, I had in this moment, I had silicone. I would like to know for how long I had problem in my right breast silicone. For how long I can keep the silicone, because I need a picture, but for how long I can keep the silicone?
Sure. The manufacturers generally say, and we say, that around 10 implants last for about 10 years. They're not a lifelong device. They're not something you're going to have forever. And so if there's nothing wrong with the implant, you don't have to get it removed. But generally, you will notice that there might be some hardening, or maybe as you age, your breast may droop and you may want to go different size. And so, they roughly, I generally tell patients they last about 10 years. But if there's nothing wrong with the implant, I've seen patients that have had implants for 20 years or so. It's just making sure that you continue to monitor and making sure there's nothing wrong with the implant. So that would be my suggestion to you.
All right, thank you for your call, Laura. And if you'd like to ask Dr. Engel a question, go ahead and call 361-4675. 361-4675, and he will answer more of your questions about breast augmentation right after the break. So please stay with us. Welcome back to Local Doctors on Call. I'm Alex Redmond. Dr. Scott Engel is joining us today, and he is telling you everything that you want to know about breast augmentation surgery. But before we continue, and we do have a phone call holding, please be advised that this show may contain sensitive material, as we are showing some graphics about before and after breast augmentation surgery. And now we have Caroline on the line. Hi, Caroline. Thank you for calling the show. Go ahead with your question.
Thank you. Yes, doctor, want to know, I have the opposite problem. My breasts are very large and very saggy. What can we do about, instead of augmentation, making them smaller and making them look better?
Sure, yeah. A lot of women with that large breasts that often wonder why women with small breasts want larger breasts. But in fact, having large breasts can cause problems like pain or problems finding the right bras or doing certain activities. You can have a breast reduction or a breast lift, and we call that a mastopexy or a breast reduction. And so you can have a procedure which we make incisions to decrease the size of the breast and lift up any drooping, lift up the breast if it's drooping. A little bit different, but certainly will improve some of the tension on your neck and shoulders and give you a more aesthetic looking breast.
And does that have a long recovery?
It's not. It's about a week where you're really kind of taking it easy. I usually say a total of about 3 weeks before you're really back and doing any exercising. But it's not a very long recovery.
All right, thank you for calling the show. And the phone lines are once again open, 361-4675, 361-4675. Dr. Scott Engel is here answering your questions about breast augmentation, and we're live tonight. All right, Dr. Engel, I believe we also have an email right now. We have an email coming up. Okay, and why don't we go ahead then and we'll show our next picture. Would you like to see patient number 2?
Sure, patient number 2.
All right, let's go ahead and have patient number 2 brought up on the screen. We're going to show you some more before and after pictures so you can see some of the surgeries that Dr. Engel's performed.
So I chose this picture. Our first patient had a silicone breast implant, and this is a young patient who was 19 years old. Silicone implants have been approved for patients 22 years and older. So this was a younger girl who wanted saline implants. So we had saline implants placed, and these were larger size implants, again placed under the muscle to give her a more natural appearance, and a 425 cc's. Now she had bigger breasts to begin with, but again she wanted just a little more volume, and so with a 425 cc implant, just gives her a nice round shape and a good cosmetic looking breast.
When somebody has a surgery like this, where is the incision? Do you go?
There's several different incisions you can make. The most common that I make are either under the breast in the crease, called the inframammary fold beneath the breast, or around the nipple, around the areola. Those are the most common ways to do it. You can also place an incision in the axilla or the armpit. You can also place an incision in the belly button. I don't particularly like that procedure because it's a long distance, but those are the typical incisions that you can make.
And what type of a scar would one typically have?
It's usually only about 3 or 4 centimeters, a really small incision, and they're really imperceptible. The one under the breast will be hidden by a bra or a bathing suit. Obviously, the one around the nipple will be won't be exposed if you're wearing a bra or bathing suit as well, and they hide really well.
All right, go ahead and call 361-4675 with your questions about breast augmentation surgery. That's 361-4675. How painful is this surgery?
It's an uncomfortable surgery. There is some discomfort, but it's not. It's not something that's debilitating. I mean, certainly patients a day or two have a little bit of discomfort, but once 2 or 3 days go by, after that week, you're really feeling much better. And light activity, I generally ask for light activity for the first week, and really no cardiac activity for about 3 weeks.
All right, thanks for calling the show. Marjorie, what would you like to ask Dr. Engel?
Yes, can you hear me?
Yeah, absolutely. You're on the air.
Thank you. I'm in my early 60s, and I have sagging, small, and dense breasts. Up until what age
can somebody have something done about that?
Well, as long as you're healthy and there's no medical conditions that would halt you from having your procedure, you can have procedures up into the, through your 70s. Nowadays, people are living longer and healthier lives. So, really, as long as you're cleared by your general doctor and that you're getting your normal mammograms, which is obviously very important, that you continue to get your yearly mammograms, there's no particular age that I choose as long as you're healthy.
Okay, well, thank you. That gives me hope.
All right, thank you for your question. And we're going to go ahead and bring up our next email question. And while we're doing that, we're going to go ahead and give you the phone number again. Our number is 361-4675, and we'll take that question in just a minute. Our email question is, my daughter has one breast that's larger than the other one. Can she have surgery to make them the same? That's a good question.
Sure, absolutely. Nobody is symmetric. Everybody is different when you split down the middle. So one breast is generally larger than the other, and some people it's more than the other, or more asymmetric than the other. So obviously, with one breast being less or larger than the other, your choice is to reduce one side or enlarge the other side, or do a combination of two if it's very, very dramatic. And so, absolutely, and I do that all the time. Sometimes we even place in different size implants to try to make that more symmetric. And so. That happens all the time.
All right, and we do have another phone call on the line. Hi, Susan. Welcome to Local Doctors on Call. What would you like to ask Dr. Engel?
I'd like to know about breast reduction.
Okay, breast reduction.
Sure, yeah. Like I said, people with large breasts often have a hard time finding good brasiers. They have a hard time with activities. So a breast reduction is a great procedure to decrease the size of your breasts, take off tension off of your neck. If you have rashes beneath your breasts, it's a procedure that's done as an outpatient. It takes about 2.5 to 3 hours to perform the procedure, and really with great results.
Thank you for your call. And if you have a question that you'd like to ask, go ahead and call 361-4675, 361-4675, because it's a great opportunity to speak to Dr. Engel before you go in for a consultation. So we talked a little bit about the mammogram. So can people get mammograms after they have implants? That's the question.
Absolutely. In fact, the imaging that we have nowadays, a lot of the breast centers are geared and know about breast implants. And so you absolutely have to continue to have a mammogram. When the implant's placed under the muscle, it's a little easier. It's much easier to detect any kind of differences in your breast tissue. Patients around the age of 40, I make sure we have a screening mammogram, a mammogram before we put the implant in, to make sure that there's any changes that occur, we'll have that baseline. And so you absolutely can have a mammogram.
All right, and now we have Amy on the line. Hi, Amy.
Hi, good evening.
Good evening. Go ahead with your question. We're ready for you.
I have an F.A.C.S, and I want to find out how long should we wait to exercise after ovulation?
Sure, absolutely. I'm going to wait until magnesium for over 3 weeks if you're doing heavy lifting. If you get a little bit sore, it's okay to go ahead and just do some gentle walk around. Heavy lifting like that.
All right, thanks.
Well,
Thank you for your call. Phone 961-4675.